Good afternoon, everyone. Welcome to our webinar for North East Yorkshire Nursing Employment Support. Apologies, we've got the incorrect date on there. That was from the first webinar. I need to change it. Today's obviously the 29th of July session. I'm going to introduce all my guest speakers shortly. Just a quick session overview that we're recording this session, and that's me. We're going to last approximately an hour. We hope you can all stay for the full session, but we're aware people are really busy. So if you do need to leave a bit early, don't worry. We're going to make sure that you get a copy of this session afterwards, along with the presentation and some additional career support resources, websites, different bits of information and advice to support you at the moment as well. There will be time for question and answer during this session after each guest speaker's had a discussion, and you can submit your questions into the chat box as well. So we will pick those up as they're coming through in the chat. We might need to answer them at the end. We might need to take away some of the questions as we did in the last webinar, and further feedback will be provided to everyone there as well. Your emails that you've registered with, we'll only be using to share any updates or feedback from this webinar. If you'd like to opt out, we've got our Nursing North England email address there on the screen for you. If you want to opt out of any feedback or anything like that, that's absolutely fine. You can let us know. And we also just want to state that the whole aim of this session is we understand that finding your first nursing role is a real challenge at the moment. So we're all here to support with different advice and guidance to help you start your career by showcasing different opportunities in nursing across various different sectors. So on that note, the agenda for today is that we've got Emma Thompson here to discuss general practice nursing as a first destination career. We've got, like I say, a bit of a Q&A session after every guest speaker as well. Nursing care with Spectrum Community Health. I think we're hopefully going to have Chloe here shortly. I'm not sure if Chloe's in the room yet, but we've got the slides we can share if not, in case there's any issues. We've then got Nicola from Skills from Care, who's going to talk about nursing within the social care sector as well. We've got Judy Watkins from the Royal College of Nursing to finish off talking about their excellent career support and helping you apply for your first role as a nurse as well. So I know there's some questions coming in on the chat. I'll deal with those shortly. I'll hand over to Emma Thompson now. Emma, you wanted to share your slides?
Yes, please. That'd be great. Thank you.
So I'll hand over now to Emma to introduce her role and her slides as well.
My slides should just be coming up now. Hopefully you can see them now, Paul. Yeah, great. So good afternoon, everybody. My name's Emma Thompson, and I'm the Nursing Director for the South Yorkshire Primary Care Workforce and Training Hub. So I'm going to talk to you a little bit today about nursing in general practice. It might be something that you've heard of before and thought about doing before. It might not have been. There's still a little bit of a rumour amongst universities that you have to have got experience in the secondary care before coming into general practice. That isn't the case. We have a lot of fantastic newly qualified nurses coming straight into general practice, where we will train you up to be a practice nurse. So I'm talking to you a little bit about what is general practice first of all. If you have any questions, pop them in the chat and I'll answer them at the end. So we talk about primary care, and primary care is made up of 4 different areas. So that's general practice, but also dentists, community pharmacy and optometry. And in primary care is really the front door of the NHS. So we have over 300 million consultations each year in primary care. And this is compared to 23 million visits to A&E each year, just to give you a little bit of context of how many people we're talking about seeing in primary care. And within general practice, the nursing role is absolutely crucial. We're like the glue that holds everything together, if you like. So a general practice nurse, what do we do in general practice? It's a really privileged position. It's a very different position. I've worked across all different sectors during my career, and that of a general practice nurse is very different. So you're sitting basically in like an office, and you have patients coming in, you're doing one-to-one consultations with patients. So it's a very privileged position. You might be seeing somebody for doing 8-week baby IMS and baby checks, and then the next patient might be an older person coming in for a COPD review or diagnosis. You may see people for diabetes. You do all the screening, sexual health stuff as well. You do a huge range of generalism skills. So it's a very different way of nursing, but incredibly rewarding. And this is Raquel, who's on the slide here, who she's come through our practice nurse training scheme called the VTS scheme, and she's working as a general practice nurse now within South Yorkshire, and she's also doing a bit of work through university. Sometimes you have a bit of a portfolio career as well, but loves her job, and she came to us as a newly qualified nurse in general practice. And about half the nurses that come onto the 1-year training program that we have are newly qualified now. So we have lots of newly qualified nurses coming in, and I think it works well in general practice, because then we can train you up then to be the best general practice nurse that you can be, and you don't necessarily come with pre-existing ideas or pre-existing training from other areas. So it is great to come into as a first destination career. Like I said, there's so many different things that you do as a practice nurse. It's very much about nursing the whole person, right from birth, say from cradle to grave. It's very much like that. Some people you can diagnose actually, and you can treat. You can get your nurse prescribing to work alongside the care that you deliver. So you, as nurses in general practice, we're often the long-term condition experts, and the GPs very much rely on us for that role. And if you have your prescribing alongside that, you become a real expert in the field. You then can go on, if you wanted to do advanced practice training as well, and become an advanced practitioner in general practice nursing. So lots and lots of opportunity, I think, as well, that you can, all the different things you can get into if you do general practice nursing as a career. Some people say, won't I be de-skilled if I go into general practice nursing first? I'd say absolutely not. It's a specialism like anything else. When I qualified, I actually, after working in surgery for a while, I went into intensive care, and I was very skilled up in intensive care. But then trying to come over to do general practice nursing, I realised I had very few transferable skills to come into practice nursing, apart from the one-on-one care that I could give well. So I had to do a whole load of different training to be a practice nurse. And it's the same, if you move sector, you always have to do different training. So it's about being upskilled in general practice nursing, as opposed to thinking you're not being skilled up, if you see what I mean. So thinking about how do we apply for a nurse in general practice, a post in general practice nursing. Every GP surgery is a different business, and I think that's what you have to sort of understand in order to get into general practice. So it's very different from secondary care. There's not necessarily agenda for change in every GP surgery. Everywhere, it doesn't always use NHS jobs to advertise the jobs. Sometimes we use Indeed, sometimes it's on the practice website, sometimes it's on local bulletins or local medical council bulletins, sometimes it's just word of mouth. So reaching out to somebody like myself who runs a training hub. So every area will have its own training hub, an own training hub lead nurse and nursing team. So sometimes it's reaching out to your local areas and saying, do you know of any jobs? So it's thinking outside of the box. I would say that's what you always have to think of when you're thinking about applying for it to be a general practice nurse. Completing the application form. This may, I'm not teaching you to suck eggs because it is slightly different. So think about what are they actually asking for, and how can you make your experience relevant to general practice. So placements in general practice are a little bit like gold dust. So you may well not have had a placement, but you really want to work in general practice. And we understand that in general practice. So make your experience relevant. So try to show why you are going to want to work in general practice as opposed to working in the community, for example. What's the difference? And to work in hospital, why general practice? Get to know the practice that you're applying to. Look on the website. What is the patient population? Why is it that area that you particularly want to work in? We're all about the patients in general practice, as we always are, but especially in general practice, we're looking at the patient population. And so you may want to work in a more deprived area, you may want to go work in student health, there's lots of different patient populations. So thinking about why do you want to work in that area. Your university, as part of your course, should offer you the opportunity to go on something called the module called the CNO002 module, which is Discovering a Nursing Career in General Practice. I know that in South Yorkshire, the training hub deliver that for Sheffield Hallam University. So please do reach out to your training hub or your university and ask if you can get on that module. It gives you a basic understanding of what general practice is, the whole landscape of general practice, how everything fits together. What does a nurse actually do? We don't teach you clinical skills, but we give you an awareness of, for example, an asthma clinic. We go through what we do in an asthma clinic, how we go through all sorts of things like that. So it's very interesting, but also it looks great on your CV. So have a think about that. It goes without saying that you need to get someone to read your application form for you and think very carefully about the use of AI. So you need to think about, yes, you can use it, but use it very much to give you a formula for how you should answer the questions, but then edit it yourself. So it can give you a structure, but then edit it yourself. It's very obvious when somebody's used AI to complete their application form. At the interview, think about, like I've talked about, the practice website, looking at fingertips data. So this is a live link that you can click on, and it tells you all the different data for your GP surgery that you're going to be applying to, how old the patient population is, and all those kind of things, which is very helpful today. You can talk about in an informed way at the interview. An informal visit is really important in general practice, and often it's a bit like your first interview. So you can go and suss the practice out and see if that's somewhere you would like to work, because every single GP's surgery is very different, but also they can suss you out a little bit as well before the interview, and you can ask questions and just get a sense of what the practice is like. And it can be like a dry run for your interview, your real interview, your first interview. I remember for my interview that I got the job for, I was taken into the staff room where there was all the practice nurses were sitting, and I sat and had a drink with them, and I got the job, and the nurses said to me afterwards, did you realise that they came straight to us afterwards and asked us whether or not we thought you would be a good fit for the team. And that wasn't my interview, that was just an informal visit. So it's thinking about that. So it's what's expected in general practice is different from what's expected for an interview and stuff, potentially in secondary care. So other things now I've put on there that you can read through yourselves as well. At the interview, think about things like where you're going to park, for example. Be on time, make sure you've got good parking. Look really engaged. You can take notes in with you, we don't mind. Show examples, always make it your experience really relevant to general practice. We won't be trying to trip you up in any way, but trying to tease out whether or not your experience can be translated into general practice, and you have an awareness of how that can happen. Most of the jobs advertised on NHS Jobs and Indeed ask for an experienced nurse, an experienced practice nurse. Please don't be put off by that. I've known 3 jobs recently that asked for an experienced practice nurse, and they've employed newly qualified nurses for all those posts. This is in South Yorkshire. And so they put that because, of course, why wouldn't you want somebody who's experienced? But the reality is they can train you up. So if you're successful, that's the time when you discuss salary and your terms and conditions. So it's not agenda for change usually. You might want to think about, it's not all about salary, it's about maternity pay, sick pay, training days, working hours and days, to get yourself at quite at the best package, if you like, that you can. There's lots of opportunity within that. So people say, well, what about agenda for change not being in general practice? It does give you opportunity to progress quite quickly, I would say. So you quite quickly you can progress from the equivalent pay from band 5 to band 6. Potentially, if you do your prescribing, you can quite quickly step up, and often more quickly than if you were in secondary care. But it's all negotiable, and it depends on which practice you're working at, and your salary will be different from the salary down the road. So it is very, very different environment to work in. But I think it's a fantastic career, absolutely brilliant career. The nurses that are coming through who were student nurses and are now got a placement and now have got jobs in general practice, love it. And they're great. They're absolutely great. They're specialising in different areas like sexual health or long-term conditions and really making it their own. So I would really encourage you to think about getting a job as a practice nurse. So I'm just going to stop sharing my slides now. I think I'm to time. And then I'm not sure if there's anything that's come up in the chat at all to answer, Paul.
There's one. I think you've addressed a lot of this in what you said, Emma. Anyway, thank you for your fantastic presentation. But somebody else has just mentioned in there that they've about them wanting experience when adverts are out, and you pointed out that actually in South Yorkshire they've taken on those newly qualified. So I think that's a big message for everyone as well. Don't be put off by that. Get your applications in. But one of the attendees has just mentioned another little bit about they've applied a few times for general practice and they've had placements there, but it's still not helped their application. So I didn't know if there was any other thoughts or additional info you had to add to that.
It's tricky. I mean, it is competitive. I think just keep going. You know, I had to apply for a lot of posts before I got my post, and I was an experienced nurse. So just keep going. I think often it's about trying to find the best fit for the team. So if they think you will fit in the team well, then they will be able to give you the training that you need. I would say I didn't say, but if you're a learning disability nurse or mental health trained or children's nurse or adult nurse, all of those nurses can get a job as a general practice nurse. So there is no limit there, which is fantastic. We really value all those, and we can train the gaps. I would say also talk to your local training hub and find out ahead of time what the training is that they can offer, so that when you go to your interview you can say, yes, I know I'm not experienced, but I know in South Yorkshire there's a 1-year training programme that I can get a place on if I get a job as a general practice nurse. And then you know, you're training your own, and you can, you know, we can work together to, I'm the nurse that you want, you know, I can fit best in the team, that kind of thing. So it's trying to get in touch with your training hub as well. And I think Paul's going to give some contact details at the end about that.
I think the other thing, sorry, I'll just come in there, Paul, if that's all right. So I'm Leslie Young. I'm one of the senior nurse and midwifery workforce leads with NHS England, and a general practice nurse through and through. Worked a long time in general practice as well. So I think when you're applying for jobs, obviously you need to look at the person's spec and think about how you fit it, but think wider than the clinical skills. It doesn't take very long to train people up to do clinical skills, things like immunisation, cervical cytology, all of them types of things. But what you've got is all of those transferable skills, that knowledge, that experience, that ability to communicate with patients at all levels and families. So think about the wider skills you've got as well, and go for a visit. Ask if you can go for a visit, a bit like Emma said. Get your face known, get that experience. Is there any areas that do a sort of a bank or locum or something like that, so you can start to get into those surgeries as well? But definitely don't hang yourself up on the clinical elements. You've got lots of clinical skills that you can transfer, lots and lots, but think about those other skills that are so important in general practice. You have a 10-minute consultation, and you've got to have the ability to make and develop that rapport in an instant, really, in general practice, and get that patient to be able to feel comfortable, their family. You will see families, you will see generations of families. So think wider than those clinical skills, although you'll have lots of them as well, but you may not have general practice specific ones, but that doesn't take long.
And that's the same. So if you were to get a job in secondary care, like I had, or community, you still need to do the 1-year training program to be a general practice nurse. It doesn't matter if you're newly qualified or if you're a very experienced secondary care nurse, you still have to do the full 1-year training program. So you're not in a disadvantage from that point of view. I think also if you have an extra skill, like you have a different language, for example, or you think you'd fit well into the team for a specific reason, do flag that up and talk about that, especially at your informal visit, just to put it in your mind. So I think that's my time. I'm happy to answer any other questions, and if anything comes up in the chat later on, Paul can always email them to me. But thank you very much.
Yeah, thank you, Emma. Cheers for that. There was just one other question there, Leslie. This might be one you might know the answer to as well. Somebody's just asking. Emma gives some great examples about newly qualified nurses getting GP nursing roles, even though the advert had said they were after somebody with experience. Somebody's asked, do you know if that was the case in West Yorkshire? Do you know if that's been happening in West Yorkshire at all?
Yeah, definitely.
Yeah,
I mean, they run the VTS as
brilliant.
well.
Good
Probably not as
stuff.
comprehensively as Emma's, because Emma's is for the nurse associates as well, but definitely they do that. And just if you want to contact the Nurse and North, then we can link you with colleagues in that training hub. So Emma's peers over in West Yorkshire. That's not a problem.
Brilliant. Thanks very much. So yeah, that's all of the questions today. Thank you, Emma. We'll let Emma's got to go now, but as she said, if there's anything that we need to pass back on to her, we'll make sure we direct that for any feedback or any answers, and we'll send that out to everybody as well. Moving on next then. Apologies from Susie and Chloe. Unfortunately, they've not been able to make it across to this webinar today to speak about their roles with Spectrum Community Health CIC. We wanted to give this brilliant showcase of examples of community voluntary independent organisations that offer roles, employment roles for nursing across the northeast and Yorkshire primarily. We know there might be people who are outside of our region. There'll still be a lot of information we can share with you, but Spectrum, fantastic an example of who employs across the region in different nursing roles. So I'll very quickly run through the slides. I'll just give a headline overview of them, so then it gives us more chance for questions, and our other guest speakers, it gives them a bit more time to do a bit of a Q&A as well. Any questions you want to direct to them, the Spectrum Healthcare, their recruitment email is at the bottom there, and there's also their website, which has a massive overview about vacancies and different things like that as well. So very quickly, what does Spectrum do? If you've not heard of them before, they're a social enterprise. They're a non-for-profit organisation that delivers a range of different community and offender healthcare services on behalf of the NHS, local authorities, public health services, and other various partners across the region as well. They're a community interest company. That's what CIC stands for, meaning that they're not for profit, and anything else is put back into, any profits are put back into projects to support public health and well-being there as well. They offer a variety of clinically led and employee-led models, which means that staff have a real say in what Spectrum do, how and influence how their services are run as well. And they run them in several different main sectors. Largest one, I think, is health and justice. They do a lot around there. They're the second largest provision prison healthcare provider in the UK, and they also lead primary care services across prisons, hospitals and immigration centres. And there's also substance and misuse recovery services within that particular sector there as well. And just those particular bullet points there show the areas that they work on, from reception to release, or from that starting point of somebody entering the prison system till their release. Things like health promotion within the service, emergency response, wound care, long-term conditions management. So there's a very varied and different role within the prison service, which is completely different to what you'll see a lot of the trusts may be advertising for at the moment as well. Sexual health services, 3 districts across the region to protect sexual health of communities, reduce rates in teenage pregnancy, and increase relationship and sexual health resilience for future generations. That's a nurse-led programme, so there's very much specialist nursing roles and also non-medical prescribing roles within those services as well. Another big one that I mentioned there earlier is the community substance misuse. So once again, that's nurse-led, providing specialist clinical expertise and alongside psychological therapies as well. So there's 3 different community sites across region for that one. Spectrum also have their own GP practices. So once again, Emma's mentioned a lot of the information there about primary care. Spectrum offers some of those services, and nursing support for local peoples included in that. Services are supported by Spectrum's corporate services, so that's across Wakefield and Darlington area there as well. Preceptorship opportunities within Spectrum, so they do offer a 12-month preceptorship programme. There's 75 hours supernumerary time, an allocated preceptor for every individual newly qualified that's going on that. There's the Preceptee network also to provide additional support, and that's available throughout 14 prisons, 2 sexual health services and 3 drug and alcohol community services. So basically all the services Spectrum run, there is that enhanced 12-month preceptorship opportunity there that you're going to get. And once again, that's something common that we hear from a lot of students or newly qualified nurses is, are the preceptorship opportunities outside of the NHS? Absolutely, they are out there. As I say, that's very much a whistle-stop tour. You'll get these slides, the questions. If there's anything, feel free to pop it in the chat box. If it's something we need to direct to Chloe or Susie, we'll do that. In the last webinar session, we had some questions that they took away and they provided us some excellent answers. So we will make sure we get those answers back if we're unable to provide the information at this moment in time. So yeah, please feel free to drop an email, have a look at the Spectrum website. And I'm going to hand over next to Nicola from Skills for Care.
Thank you, Paul. My name is Nicola Greenwood and I am a locality manager in the Yorkshire, Cumbria and North East area, and I work for Skills for Care. I'm going to spend the next session just talking about what social care nursing is, and dispelling some of the myths that you may well have heard around working within social care. Next slide, please, Paul. So why social care? Well, the reality is that it is a fact that social care will at some point impact on all of our lives, whether that's through a loved one who needs care and support, or perhaps ourselves, in order that we can live our best lives. Next slide, please, Paul. So what do we mean by social care? Well, it is about support, the health and support and care that we all need to live our best lives, typically, but not exclusively, as we get older. For some people, we will need ongoing nursing care for conditions which do not require hospitalisation, but we're unable to look after ourselves independently. So we're needing that nursing support to help us continue our lives as best we can. Social care nursing allows us to continue, allows us to enable people to continue to live the lives that they want to live. Data out today shows that there are 1.7 million people that work within social care. So collectively, we are bigger than the NHS that employs around 1.5 million people. Next slide, please, Paul. So the ethos of nursing in social care is probably best defined by the type of care provided, rather than looking at the funding sources. And it's where we talk about a social model of care that registered nurses and nursing associates can affiliate to. Social care nurses are dedicated to person-centred, strength-based and collaborative care that is delivered in partnership with individuals and their families. As a social care nurse, you will work with a wide range of colleagues, including nursing teams, GP practices, secondary care colleagues, allied health professionals, as well as the voluntary sector. Next slide, please, Paul. So where do social care nurses and nursing associates work? You will possibly seen some of these logos around your localities. excuse me, but this is just a small snapshot of the scale of social care in the Yorkshire, Cumbria and North East area. There are 649 nursing homes within our region. 372 of those are in Yorkshire and Humber, 245 within the North East, and for those of you on the call from Cumbria, there are 32 nursing homes. So we have nursing homes in every part of our geographical footprint. And some of those homes are larger homes that are part of a national company, but the majority are much smaller independent social care providers that might just be around the corner from you. Next slide, please, Paul. So where do social care nurses and nursing associates work? Well, they work in a variety of places, in community care services that you might know as home care or domiciliary care. They work within nursing home, registered care home with nursing services. That could be mental health specific, learning disability, complex care, dementia or end of life specific, or they may be more generalist nursing homes. We have day centres and other community-based services, and we have nurses working within the charity sector as well. Next slide, please, Paul. There we go. So what roles are there for nurses within social care? Well, there is the role of the nurse, providing that care to its residents. You can also progress to being a deputy manager, a registered manager, a day centre lead, a clinical lead, or a role within research. There are also other regional and national leads that may have a strategic focus, a learning and development role, quality assurance, compliance, or you may even aspire to be a director at some point in your future. There are a whole plethora of jobs and roles available for you. Next slide, please, Paul. We do hear many people asking whether a career in social care is a long-term option, and we at Skills for Care absolutely believe that it is. We've recently, in the last 12 months, published a workforce strategy for adult social care, and that strategy clearly demonstrates that nursing is an essential and valuable component of social care that will enable people to continue to thrive within their own homes. Next slide, please, Paul. Our strategy outlines a number of facts, and we've got some more recent data from following our strategy. There are 13.8 million people aged 65, or we expect to be 13.8 million people by 2035 who are aged over 65. We expect the number of people with dementia to increase by 43% by 2040. The number of people with a learning disability, mental health need, or physical disability is also projected to increase. And by the time a person is aged 75, they are 60% more likely to possess two or more significant conditions that will require social care support in the future. Projections 12 months ago suggested that social care needed another 540,000 new posts into social care by 2040. There has been, over the last 12 months, some significant improvement in the number of posts recruited to within social care. And today, our recent report that we published indicate that number has reduced to 470,000 extra posts that are needed by 2040. Next slide, please, Paul. So one of the myths within social care that we hear about social care is that there isn't the opportunity for preceptorship. I can absolutely assure you that social care providers are increasingly developing preceptorship programs to support and retain newly qualified nurses. Those preceptorship programs will afford people to have supernumerary time, and you will be allocated a named protector. Next slide, please, Paul. We also hear that nurses are concerned that they will not be able to meet the requirements of revalidation if they work within social care. We can absolutely assure you that the work that you would do as a social care nurse and the duties that you would perform easily satisfy the skills and scope requirements of working within of meeting the requirements for revalidation. Next slide, please, Paul. So where might you be able to find a job? Much like primary care, there is social care providers are typically either large national businesses, or they are small independent businesses. There is no job site like NHS Jobs where all the vacancies are advertised. So there isn't that one-stop shop. Some of the four areas that I've identified on the slide, so carehome.co.uk, Indeed, the government Find a Job site, or Total Jobs are some of the areas where you might want to look and explore what job opportunities exist. However, there are some other simple techniques where you can try and find the jobs by looking around you and keep persevering. As you're walking or driving around, look where your social care providers are. Typically, they will advertise outside their premises if they have vacancies. So do keep your eye open as you're wandering around and see what opportunities may be there. Do search through Google or other platforms about care home vacancies near you, and you will find a list of jobs that come up within your area. Keep looking on Facebook, look on LinkedIn. They are also very good platforms for you to be able to identify what vacancies exist in your area. But do keep persevering, because one provider may not advertise a job today, but by the end of the week they may have a job advertised on their site or in one of these platforms. So do keep looking, because the situation is ever changing within the social care landscape. Next slide, please, Paul. So what do nurses say about working in social care? If you can pop on to the next slide, please, Paul, that'd be great. Here are a few of the sound bites that we have from people who work in social care. And we could provide you with a lot more. But they all demonstrate that it provides value. They enjoy the role. They have the ability and the privilege to be able to have that enduring relationship with the people that they care for. From helping and supporting them through all of their journey throughout social care. Next slide, please, Paul. So how can you get involved and understand what's going on in social care more in your area? We do have the Social Care Nursing Forum that you are able to join as a student nurse. We have regular newsletters that will share with you what's going on within social care. Yeah, there are teams, locality teams working in your area that you can make contact with and who can help and support you in trying to find a job. And we have other nursing forums and networks as well. And I think that's the end of my slide, Paul. So if anybody's got any questions.
There's brilliant. Thanks so much for that, Nicola. There's one question which I think once again is being addressed by your slide with some of the quotes from nurses employed within social care. Being a mental health nurse, but somebody's just asked they would like to know more about care home options, employment options as a mental health nurse. I don't know if you had any other info to share on that.
Well, I mean, we are a vast geographical area, so it does all depend on where the individual is located. But if they do want to contact me, I'm happy for my contact details to be shared, Paul, I can certainly put you in touch with the locality manager in that area that can help and provide some guidance on what opportunities exist within their area.
Brilliant. Cheers, Nicola. Yeah, there's somebody else who's just put another question in about, I don't know whether Leslie might have any further information about this. Is anyone who's just joined Leslie Young's our nursing workforce lead as well. Somebody's just mentioned as a newly qualified, due to qualify in a few months, sorry, just asking about current issues around newly qualified nursing roles within local trusts. Is there any updates regarding this? I've not heard anything, Leslie. I'm not sure if you know anything.
I mean, we are very much aware in NHS England, so please don't feel that there's no work going on and no one's listening. There is a national group looking at this, and that's been overseen by Duncan Barton, our Chief Nursing Officer for England. There's also a regional group. There's lots of work going on with colleagues across all systems and all organisations and providers, and obviously you've just heard from a few today around that preceptorship offer, and also exploration of how we can support newly qualified nurses, midwives, nursing associates who don't secure roles to ensure they get some sort of element of preceptorship as well, to really support that progression into the workforce. So I can't give any specifics about any specific trusts. Obviously, vacancies are worked on their workforce planning. And one thing I would say is that the trusts are obviously often under scrutiny around the headcount. So whereas in there's maybe some opportunities to make 3 jobs part-time, sometimes that's not the opportunity for the trust because they're also being scrutinised on headcount. So if you have 3 whole-time equivalents and you have 3 people, but then you could maybe split that into 4 people, but then they're getting scrutinised on that headcount. So we are aware there is work going on both at a regional and a national level and across all systems, and that's one of the reasons for this these series of webinars as well with colleagues from other sectors. And sometimes the job you get is the job you were meant to have, and I know that doesn't sort of give any comfort when you're looking for a job. Sometimes the job that you think you want, and you apply for something else and end up somewhere else, and your career takes you on a different journey. Sometimes that's where you were always meant to be. So please don't lose hope, but keep looking and look outside those traditional areas. As you've heard today, there's a myth about you have to work 2 years within a trust before you can work in any community settings or social care. Social care, you're going to get to have so much autonomy. Obviously my background was general practice. I'm really passionate about general practice and the opportunities that can bring, and the opportunities for development that can bring throughout your career. And you can sort of get promoted, increase, and actually all the time in these areas you're with your patients. Sometimes in trusts that doesn't happen. The higher up the banding you get, the further removed you are from your patients and your families, and that's where that's why we're all here at the end of the day, to ensure that delivery of high quality care to everyone. So I know it's tough out there. It is competitive. Have a look at job specs. Make sure you are demonstrating how you match them. As I said before, sometimes not about the clinical skills. Sometimes it's about those other transferable skills that you've got, that ability to link and develop a relationship really quickly with a patient, and all of those types of experiences. Don't underrate how important they are.
Brilliant. Thanks so much for that, Leslie. And following on from Leslie's point about, it is competitive, and do your homework, get some support. I'm going to hand over now to Julie Watkins from the Royal College of Nursing to discuss their fantastic career support that they can offer for your first job role.
Yeah, hi everyone. Thanks, Paul. And thanks for inviting me along. I'm delighted to speak to you all today. Hopefully I'll be able to give you some practical tips. I mean, we've had some brilliant ideas then in terms of what else is out there. So hopefully I can give you some practical tips then to go alongside that. So my name is Julie, and I'm a career coach with the Royal College of Nursing. If you go to the next slide, please. So everything, don't worry about frantically trying to write things down today. Everything that I speak about you can find on our online pages. So that's www.rcn.org.uk/careers. So I'd always say go there in the first instance and you'll be able to navigate what you're looking for from there. And in more detail, I guess, on what we're going to talk about today. Next slide, please, Paul. So we're going to go through some top tips, as I said, and we're going to give you some practical information as well as to what you can apply straight away. One of our first tips, you can prepare a good CV. You can do that now. You can start by, even just having a bit of your placement history, any employment experience. You can already map that out if you don't have a CV that's up to date at the moment. We've got online advice, we've got sample CVs, we've got webinars, and we can help you with all of that. So as I said, go online first and have a look at our samples if you haven't written a CV. And you can use our CV check-in service. So if you're a member of the Royal College of Nursing, you can email us a copy of your CV and we can give you some email feedback on that. Next slide, please. These are some of the tips to go away with, I guess, today in terms of writing your CV. Make sure it's on 2 sides of A4. If you've got anything that's over 2 sides, you can call it your master CV and you can keep it as, this is for my eyes only. And then when you're going to write a tailored CV, then you might be able to cut and paste the relevant part into a 2 sides of A4 tailored CV. And that's an important factor to go away with, always making sure that it is tailored to the job that you're applying for. If you're writing a generic CV or if you're sending it to lots and lots of different employers, they usually will know. We've had an overview today of general practice, working in the social care, care homes, nursing homes, all of that. Make sure you're tailoring it to those fields and those roles, and not sending a generic one. We've heard today it is competitive out there, so make sure you're doing everything that you can to put yourself into a really good position to get shortlisted. Have a think about what's going to be appealing to them, what's going to be relevant, and what might impress that particular employer, and all of that will be part of your research. Next slide, please. You can also start to prepare for writing your supporting statement. So this is the most important factor of the application process. So if you were going on NHS jobs or even, some independent field employers, make sure you've got that supporting statement section and that you've learned that technique now ready. We get lots of students who perhaps haven't even looked at a person's spec, maybe sending through a supporting statement, and it's just not tailored to the role. So you're not going to get shortlisted if you're not meeting that criteria. So familiarise yourself with person specs, job descriptions, employers' values. You can do all of that now. What are they looking for? And again, we've got online advice, we've got sample statements, and we can also give you feedback on any supporting statements. You can email that through with a copy of the person's spec, the job advert, and we can give you some feedback to see if you're meeting that criteria. Next slide, please. And then these are perhaps some of the most important statement tips. We tend to say to perhaps structure your statements. You've got 3 sections. So you've got an introduction, you've got the main body, and you've got the conclusion. So the introduction, why are you applying for this role? Introduce yourself. It can easily get left off an application, but make sure you introduce yourself as you would in person. Make sure you're mentioning the name of the trust or the organisation. And make sure you're mentioning as well the job title in that introduction. You might want to touch upon the values there. If you don't mention any values, you can always pop them into the conclusion as well. Address all of the essential criteria from the person specs. So this is your checklist. that's usually what an employer will use to shortlist you. Have you met that essential criteria in the person's spec? You want to show you've researched the job and the employer. You've got a good understanding of the role. As I mentioned, you mentioned in the field, you mentioned in the trust, or you mentioned in the organisation. And you want to make it as relevant with real life examples as possible. So some people can struggle with giving an example in a statement. I think it's easier sometimes to talk it through. So we recommend using a CAR technique. You might have heard of the STAR with interviews, and I'll go through an example of that. But let's take a little look at that CAR technique. So this is a shorter version on writing a supporting statement. So if in their person specification, part of the essential criteria is working in the MDT, then you need to give a specific example of that. So this just helps you to break it down. So you know, you've got the context, you're talking about whilst you were working on a placement, what kind of meetings you're attending. You've got the action. This is what I actually did. This is my contribution to working within the MDT. And then this is the result. This is the outcome. You know, what did your contribution and your input help to inform? Here, you know, we're talking about care planning, guiding changes and improving well-being. So it just gives you an idea of how to write your examples in a supporting statement. We find this works really well to make sure you're getting shortlisted. Next slide, please, Paul. And then once you've been shortlisted, hopefully you get invited for an interview. We offer one-to-one interview coaching. So again, if you're a member of the RCN, you can book that with RCN Direct, come through, and we can try and help you to preempt what questions might come up, but also it's an opportunity just to practice your answers and practice that STAR technique as well. You can also think about STAR examples. So if you're concerned about, oh gosh, you know, I don't know what examples I'm going to use, STAR examples are thinking about your STAR stories. You know, what are your highlights in your career, in your training, in your placements, anything like that? What are your highlights so far? Are there any situations that kind of stand out for you? Because usually you'll find there's so many aspects of skills, and I know that I think it might have been, it was either Leslie or Nicola, I'm not sure. They talked about transferable skills. You know, there's so many transferable skills in one particular situation. But if it's something that stands out to you and you can really recall, it's easy for you to communicate at interview. And generally your tone of voice will change, your posture, because it might be something you're quite proud of. You know, it might have been a difficult situation, but you might be proud of what you achieved in that situation and what the outcome was. So that's another way of thinking about it as well. Next slide, please. And then here's an example of the STAR. Hopefully you've all heard of the STAR technique. So you've got the situation, you've got the task or the target, you know, what was your goal, what was your action, and what was the result? And this, you know, you've got the CAR for the application, and then the STAR is going to be used at interviewed. So, for example, how do you prioritise your workload? The situation, always think, you know, you're setting the scene for them, you're giving them a bit of context. So whilst I was on placement, you know, I was supporting a nurse with multiple patients. You're just giving them the context, you know, you don't have to worry too much about it, but you're just setting the scene for them. The task then is going to be your goal, your target. What did you want to achieve in that situation? So here we talk about ensuring all patients received safe and timely care while managing my own delegated tasks. Then most of the what you're going to say will be in the action and the result. So, you know, the action, this is what I actually did. So I assessed who required urgent care first, such as administering time-critical medications, then organised routine observations and documentation around these priorities whilst communicating with my mentor. Now, what was the result? This ensured all patients received appropriate care promptly and my mentor praised my ability to think ahead and remain calm under pressure. So that usually will help you to give a panel everything that they might be looking for. It's quite concise, but you're capturing all of the aspects that they might be looking for in terms of their shortlisting and their scoring. Okay, next slide, please. And then just some general other tips then to kind of stand out and help you really on your journey. Next slide, please. Join the RCN forums. There's some brilliant Facebook group discussions. So if you want to know something about a particular nursing field, go and join the forums. You know, they're experts within that field. It's an opportunity to network. So I know that there's one for general practice. You know, here we're looking at advanced nurse practitioner forum. If you've got a question about a particular aspect, then, you know, go to the forums, because they're going to know and be able to help you. The RCN also have professional leads. So again, that's their expertise. You can reach out, you'll find their details in the Meet the Team section as well, or you can drop them an email. Next slide, please. Research the roles, the employers and the values. Again, you need to make sure you're reading everything carefully. People sometimes don't get shortlisted. It's not because they can't do the job, it's just because they haven't conveyed it in terms of what an employer wants in an application form. So that's why, you know, really making sure you're reading all of the documentation attached to any recruitment or jobs really carefully. What services is somebody offering, and are they only running any initiatives? Make sure you know what their values are, or their vision, or perhaps their strategic plan as well moving forward. Next slide, please. And I think it was Emma who talked about a little bit more detail, I guess, around informal visits. So I'll just quickly recap, you know, what Emma said. It's a brilliant opportunity to create a good first impression and also break the ice. You know, making sure through an informal visit, you're still going to be professional, even though, you know, that word informal is in there. I think it takes under 10 seconds to create a really good first impression. So, you know, that will be their first impression of you then in that visit. It helps you with the interview and help you with your application. You can get tips on the role, you know, get more of an insight into the workplace. You can ask them, you know, what kind of person are you looking for? Again, that's going to help you with your interview and your application. And you can also pop that in the introduction in terms of your supporting statement as well. You know, you recently had an informal visit with whoever that was, and what perhaps impressed you for that. So you can convey it in your application also. Next slide, please. And just to give you an overview, you know, of how we can help you if you're members with the RCN, we mentioned email feedback. So email us your CV, email us your supporting statement, and we can give you some email feedback on that. We offer telephone career coaching and telephone interview coaching. So these are one-to-one sessions. Career coaching can look at perhaps if you're feeling a little bit stuck or not sure where to go. We certainly can't tell you what to do, but we can help to navigate your ideas. Or maybe you're thinking, oh gosh, you know, which direction do I go in? But you've got those ideas, then we can talk that through with you. And then the interview coaching is an opportunity to rehearse your answers. We can answer any kind of questions that you may have, or we can give you some constructive feedback. Definitely make sure you try and practice. If it's not with the RCN, you know, if you've got a career advisor elsewhere, practice interview questions with them. Next slide, please. So everything, you know, as I said, we've spoken about today will be online. There's the website address again. If you have any questions, you can feel free to drop an email. It's career.service@rcn.org.uk. And yeah, I know it's an exciting time for you all. I know it's competitive at the moment and there can be some challenges, but certainly we're here to help you as well. And, you know, good luck with everything and thank you.
Thanks so much, Julie. Fantastic information. Just to reaffirm as well, the fees for students, is it third year students, is it £10 a year, is it?
Yeah, it is.
Yeah.
And so you know, that's quite cheap, isn't it? I don't know what to give it an equivalent to as a bottle of wine these days, but yeah.
It's quite typical, isn't it?
It's such a good sort of investment. You know, if you look at, that's just us as one service you can access. You know, we've got kind of like a counselling team, you can have workplace advice, you can have so much more than for that £10 a year. Is definitely worth it.
Yeah, thank you. There's some fantastic resources on the website as well that we've been promoting. There was one question that was kindly answered in the chat as well, but I just thought I would ask you, because there might be a bit more information to direct you, this individual on. Somebody had asked about tailoring the applications, and that was just before you went through the car and star technique, which is brilliant. But you know, the examples you've given there, I think if you got more examples on the website as well, or in your one-to-one sessions.
Yeah, absolutely. We've got sample supporting statements online as well.
Fantastic.
And we've got them for, you know, each kind of different, you know, nurse support worker, newly registered nurse and nurse. We've got lots of different examples on there, along with other, you know, kind of ideas. So yeah, definitely. You do have to be a member to access the samples, but there is free information on there as well.
Yeah, fantastic. I thought that was the case, Julie. So just wanted to bring that up for the individual on the call, or there might be a few people who are thinking, we want to know more examples, maybe something that's specific to their field of nursing or for newly qualified. So have a look at those resources, get them accessed there as well.
Absolutely.
Fantastic. Thank you so much for that. There was one other question as well, which I'll direct to Leslie, which is somebody's asked if they're struggling to get a nursing job, if they're working as a healthcare assistant, can they still continue to do that if they haven't applied for their PIN?
Yeah, so this has come up a few times. And obviously, if you're working as a healthcare support worker and that's your contract of employment, that's fine. But we would recommend that you do apply for your PIN, because what can happen sometimes is time will go by, and then you then might have more challenge getting onto the register. But I know Paul, as a return to practice coordinator, has had some conversations with nurses and midwives who haven't registered and then want to do a return to practice. Well, you can't do a return to practice if you've never been on the register. So we would strongly suggest that people do register and get their PIN. Saying that, there has been a lot of discussion. The Chief Nursing Officer, Duncan Barton, has come out and said that he doesn't recommend that you would work as a healthcare support worker. And obviously we've got Julie on the call from the RCN as well. If you have a PIN or or a maternity support worker, whichever area you work in, because there is that complexity and grey area around working under your contract of employment, but also having a PIN and being on the NMC register and under the guidance of the NMC code. I have had some conversations with the NMC, who again would state that they wouldn't be something they would suggest, that you would have to that you would work as a healthcare support worker as someone with a registration on the NMC. The reason being is if you're under a contract of employment as a healthcare support worker and you actually have a PIN and something happens, that is a nursing role, and you step into that space, then you are outside of your contract of employment. However, if you don't step into that role, so someone needs defibrillated or something, then the NMC will see that as a mission of practice and care under the NMC code. So it gets very grey and very complex. So that the message from Duncan Barton is very much that he wouldn't support that. So you do have to think long and hard about your decision that you do, because time goes by super fast. Julie, I don't know whether you've got anything to add to that from an RCN perspective.
Yeah, it's a challenging one, isn't it? It's more around boundaries, and I guess that, like, RCN Direct would be our first port of calls if you've got any, queries around, oh gosh, should I, shouldn't I, what should I be considering? RCN Direct would definitely, would certainly be able to kind of talk you through that, just in terms of the practical aspects, which you've covered pretty much, but it's about the boundaries, isn't it?
Yeah.
And stepping in and outside of those, which can get a little bit grey, as you mentioned. But yeah, RCN Direct can give any more practical advice on that.
And obviously, Amy, I've said that I can see that you've put in, how are you supposed to pay your mortgage and that, and I totally get that. But what we're saying is that if you then register, you need to be really careful with your decisions that you make. Obviously, they have to be a personal decision and nothing that we can influence, but you need to be really careful of where you sit in that employment and regulation space.
Thanks both. Yeah, a few of the people have put questions in around that debate around it is a very difficult one, about applying for your PIN and how that affects your role as a healthcare assistant if you can't get a nursing role. And somebody's mentioned about that, if we're not going to get a job, how are we going to pay for our mortgage and bills? Completely understand it. I think the vast majority, if not all of us on this call, will be in that situation where we've got to pay for a mortgage and bills. So we understand people need jobs and they need to do something. You might need to step away and do something else. What Leslie and I were getting across at is, and as Leslie mentioned, for my return to practice, I look at where people who've stepped away from nursing or have left for whatever reason and their PIN has lapsed, in order to come back to return to practice really easily and to have a funded program, you need to have had at least one registration with the NMC. So that would make life much easier if you do that. So if people do register and then they go and do something totally different because they have to, I've spoken to returners in that situation before where they've gone and became teachers, shop workers, whatever it happens to be. We understand it, but we just wanted to reiterate that having that NMC PIN means that if you do need to return to practice at a later date, it makes life much easier. I don't know if there was anything else you wanted to add to that, Leslie or Julie or anyone else.
I mean, I think it goes back to, to try and reassure, and I know it's really difficult, and we do have these peaks and troughs around employment as people qualify, and it's not easy when you're in that situation, but there is work going on nationally and regionally. We are looking at options for things like preceptorship, in an alternative manner with organisations, for those who perhaps don't secure a role, but how can we support them to at least get that sort of element of practice that we need to support you, because we don't want to lose you to the system, and the situation is really complex, which doesn't help, as you say, Amy, when you've got mortgages and bills to pay, and I totally appreciate that. But there is work going on, so please don't think that people aren't listening and aren't doing something about it, because they very much are, and obviously we're as concerned as yourselves.
One of the quick one as well, somebody mentioned about can you email specific departments, particularly in hospitals, to look at asking for jobs. One thing I would say is, Nicola from Skills for Care mentioned earlier, a really good one. Have a look on LinkedIn as well. A lot of the chiefs, your heads of service for different nursing departments, those that are doing different nursing projects or clinics, they'll put stuff on LinkedIn as well, and you can absolutely contact them as well. But have a look on trust websites, if there's named contacts for any particular work or project or departments, then absolutely I would say go for it. And once again, going back to what Julie and Nicola and Emma said as well, if you can get an opportunity to go down and introduce yourself to them, have a visit, then that might be a way to get your foot in the door as well.
Yeah, and I think I was just going to say, as Leslie was just saying, I know that the RCN recently have, we are doing something about it as well. We've run a survey which is closed now, but around driving change and support for student members to understand what's going out there, and to try and put something in place about the availability of jobs and for the third year students. So we've recently, you know, been campaigning on that, and we've run a survey. So yeah, you know, just to reassure you, know, we are, all of us are doing something about it.
Brilliant. I've put up our regional inbox that Leslie and I and the rest of the team get as well. So anything else, anything with a bit more detail, anything you think of after the webinar that wasn't asked, please do send us across an email. You can put a bit more detail in there if you need to, and we will get back to you, you know, within a few days, and or if we need to rearrange a chat with you, we can do. That's been done before. Yeah, the presentations, the recording of this, it will be sent shortly afterwards with the other resources and the other information as well. And once again, if you've got any other questions or queries, you know, Julie's RCN details, Spectrum Healthcare, primary care hubs, and Skills for Care, all of those contact details will be on there. So please, as we say, just drop us an email if there's anything else that we can support with. We do know it's really difficult. We're here to help as much as we can. We do wish you all the best of luck. We hope that this has provided you some new thoughts, some new lines of inquiry, but as I say, keep the conversation going as well, and share your thoughts as well. We'll be emailing across shortly and asking for your feedback and your ideas moving forward for what we can do to help you with as well. I'm afraid we'll have to wrap up and finish for this afternoon. Massive thanks to Julie, Nicola and Emma as our guest speakers as well. And massive thanks to Leslie for coming and providing some additional information and advice as well. And yeah, we will speak again shortly. Thanks very much.
Thank you. Bye.